Welcome. I'm Jan Marini, the founder of Jan Marini Skin Research. I am here today with Mary. And Mary is here for a consultation. Tell us a little bit about yourself.
I'm a psychotherapist. I've been practicing for about 18 years. I have an office in Los Gatos. I'm also practiced in Noe Valley in San Francisco. I have a 4-year-old daughter, and I have been married for 27 years.
Well, can I ask you a few questions?
Absolutely.
If there was something you could change or improve about your skin, what would it be?
There are several things I would like to improve. I'd like to improve elasticity in my face, the size of my pores that are changing, hyperpigmentation, some crepiness around my eyes, and 6 months ago I was diagnosed with acne rosacea.
Okay. And so I have to let you in on a little secret. We actually started this consultation and we had to readjust the equipment. So the reason I'm not writing really fast is because I already wrote this down. But you also said at that time that your face looked you felt your face looked dull.
Dull,
okay.
Yes, and losing some volume in my face.
Okay.
Certainly. Yes.
We have a lot to talk about.
We have a lot to talk about.
So how would you categorize your skin? Do you think it's normal, combination, oily?
Dry. I would say it's dry the older that I get. And you had mentioned something about it's not tightness that's dry, but like loss of glow. Like I don't have much glow in my face.
So what I'm hearing her say is that probably your skin is more normal to dry. She does not have obvious oil, but she doesn't feel real tight and dry, and you're not flaky.
Correct.
Okay.
I do drink lots of water, so that helps,
okay.
I think.
And so tell me, were you ever a smoker?
When I was a teenager, when I was in college, I did smoke some, but it wasn't anything that I became addicted to long term.
Okay. Yeah. And sunbather?
Big sunbather. I grew up in Texas. I was a tennis player and was outside all the time. From the time I was a little kid, I can remember being outside until at least I became a little bit aware of not being in the sun as much, but that didn't happen until my 20s.
Okay. All right. So let's talk about some of your concerns. So where do you think you have hyperpigmentation?
I know I have it all over my body, but I'm definitely getting it in my chest and in my face. I did have some IPL about 4 years ago, which I think helped some, but it's all starting to come back. Okay. I've noticed too, even with sunblock
So
use.
when she said IPL, what that stands for intense pulse light. It is kind of a laser, but it's not a true laser. But what the light actually is attracted to anywhere in the face where there's red or brown. So IPL can work for rosacea. IPL can work for pigment. And it's attracted to the brown pigment, and it helps to disperse these pigment cells, and it helps to lessen the appearance of pigment. It can be very effective. Now, the thing about IPL is with any of those kinds of treatments, because pigmentation is sun damage, and it's been programmed in your skin, is you kind of have to keep it up. So even if you see a really good result, you have to go back periodically and keep it up. And sometimes if you haven't kept it up, and the sun exposure that you've had over the years begins to show in pigmentation, it can get worse and worse. So
that's good to know.
But you did have a good result with the IPL.
I had a very good result with the IPL. So it sounds like it might be time for another treatment.
And so tell me, where do you think your pores look larger?
On my forehead, certainly, and starting to on my nose, and I've noticed some really large ones on my cheek that are starting. But my forehead is the one that I really notice a lot. Okay. Yeah.
And I'm going to talk more about this, but just so I don't forget, I want to say something about pores. So 80% of our dermis is collagen, and collagen acts like a girdle around pores. So there's two things that can affect pores, or actually three things. One is heredity. Some people just inherit a tendency to larger pores. Second thing would be retentive matter. So if you have a tendency to acne or clogged pores, then that causes the pore to dilate. But the third thing is that as the collagen decreases in the dermis, you don't have the same girdle, and the pores tend to become, for want of a better word, kind of flabby. So if you can increase collagen, if you can resurface the skin, you can oftentimes dramatically make those pores appear smaller. Now, they're not trap doors. You can't open and close them, but you can really refine them tremendously. And as I've said before, you've heard me say this before, I'm a 2-time Accutane failure, and I had some pretty large pores on my face, and basically you can't see them anymore. So there are things that we can do. So tell me a little bit about the rosacea. Where does it show up? Where do you think you have the rosacea or the appearance of it?
It is mostly on the left side, the left cheek over here. I never had acne when I was growing up. So when I started getting these kind of almost cystic type acne around my cycle, I just thought, oh, well, this is a fluke. This is just happening. Maybe I ate something, and then that didn't agree with my body. And but then it started happening every month around ovulation, around anything around my cycle. It was just erupting. I went to my primary care, who then sent a picture to the dermatologist and sent back a response right away saying, looks like rosacea to me.
Okay,
Acne.
so it looks like rosacea. So the derm didn't actually examine you.
The dermatologist did not examine me.
Now, when you look in a mirror and you look closely at that area, do you see what's called telangiectasias? Those are dilated capillaries.
No, I have not seen that.
Okay.
I don't think I've seen that. I don't know if I've looked close enough.
So are you what we refer to as a flusher blusher? If you have a glass of let's say red wine, or you eat spicy food, do you flush and blush?
Yes.
Okay.
I do.
So the reason I'm asking these questions is that in rosacea, particularly when it goes into sort of secondary rosacea, a person can have papules and pustules. They look just like acne. They're not acne. In fact, acne rosacea is actually an outdated term because acne and rosacea are two separate things. Now, they're both inflammatory disorders, but what happens in rosacea is that there can be pustules, papules, there can even be large lesions, but they're caused not by bacteria, but by inflammatory factors. And if you were to biopsy an acne lesion, what defines an acne lesion is it starts off with a microcomido. In rosacea, there's no microcomido, two different kinds of lesions. Okay. Now, a person can have rosacea. They can have rosacea lesions. They can also have acne and acne lesions. So I worked with individuals that had rosacea and they had lesions in their cheek area, but they had acne on the chin.
I do get it there too.
It would be really good at some point, probably for you, to be actually examined by a dermatologist. And the reason that I say this is that in as much as 48% of individuals that have facial rosacea, that they have actually ocular rosacea as well.
Okay.
Now, ocular rosacea can be something where people don't even really realize they have it. Sometimes their eyes are irritated or they're red, or it can be to the extent where they wake up and they have crusting in the eyelashes and things like that. But it's just good to get it checked out. Because ocular rosacea, if it goes untreated, if it's really, really bad, which is certainly not the case here, that it can actually cause blindness. So it's just really good to have that checked out. And also to see that you don't have some exotic form of rosacea. Okay. So at this point, we know that the dermatologist looked at a photo and they think it's rosacea, but we don't know 100%. But what she's saying in terms of the flushing and the blushing, vasomotor instability is a key factor in rosacea. And so there's probably a good chance that you do, although I will tell you, it appears to me to be fairly mild. And it can be progressive.
Today it does. I was just saying that to someone. I was like, oh, I'm not here when it's really flaring.
Well, I've always said, if I'm sick and I go to the doctor, I don't really need to see the doctor. All I need to do is sit in the waiting room because it'll go away. But that's always the case. In rosacea, you have good days and you have bad days. And you have some days where, your skin really isn't red at all, and other days where it can just be problematic and constantly flush and blush and you can have redness. So, at any rate.
Yes.
So did the doctor prescribe something for you?
Metrogel.
Okay, Metrogel. Okay. Now tell me what your experience has been with the Metrogel.
Honestly, I have to say it's difficult to know because I feel like my skin kind of does its own thing regardless of whether or not I'm doing it or not. So in fact, what I did was I actually stopped doing the Metrogel a week before I came to see you because I really wanted to see what it did without the Metrogel, if it would really, flame up. And in fact, as you can see today, it doesn't really look that bad. And I haven't been on the Metrogel for almost 7 days. So honestly, I have to say, I don't think the Metrogel has done much.
Well, rosacea is very complex. Now, there are a lot of things that you can do for rosacea that are very helpful. And some people do well with Metrogel. Other people don't do well with it. For some people, it can take months before they see a result. Metrogel is actually part anti-inflammatory, part antibacterial, and part insecticide because there was a belief that rosacea had something to do with what's called the demodex mite, which is a little parasite. We all have them, but in rosacea, it kind of attaches itself in the follicle. And we're really not certain that that is necessarily a primary factor in rosacea. So oftentimes it's so complex that Metrogel maybe just isn't the right thing for you. Now, one of the reasons why antibiotics work in rosacea is not because there's a target organism, not because it's going after some bacteria, because antibiotics are anti-inflammatory. Rosacea is an inflammatory disorder. One of the, if your rosacea is more severe, one of the things that you could consider is something called Oracea. Now, Oracea is a relatively new drug, as drugs go for rosacea. Oracea is actually an antibiotic, but it's a sub-antibiotic. It's such a low dosage. It's 40 milligrams time release. It's such a low dosage that you wouldn't be able to use it for an infection. It's such a low dosage that you can't develop antibiotic resistance. You can't develop things like yeast infections and things like that. They've never seen cases of that. It strictly works as an anti-inflammatory. It doesn't really get rid of the telangiectasia, but it can have a major assistance with flushing and blushing and kind of keeping the disease sort of at a stable level. Now, I think there's some other things that we can do as well, okay, to help with the appearance of the redness. But again, it's good probably just to get it checked out. Okay, so I'm getting ahead of myself because there's some things that I didn't want to forget to talk about. So let me ask you, what do you use in the morning?
I am... Honestly, right now I'm not using anything because I've been afraid of having my face break out. So It's been a while since I've been using really anything.
Well, what were you using typically?
I was using some under eye cream.
What do you wash with in the morning, for example?
I actually just use facial wipes in the morning. I do not wash my face in the morning.
Were you washing it before?
No, I haven't washed my face in the morning in a while. I just typically wipe it with facial wipes.
Just what type of facial wipe?
It's like Burt's Bees facial wipes that are unscented.
Okay, and then what did you do after that?
After that, I have been using, it's a SkinCeuticals product. It's a ferulic acid product.
Oh, CE ferulic?
That's it. That's what I've been using.
Now, did that bother your skin as all as far as, it has a fairly low pH, so sometimes in some individuals with rosacea it can kind of trigger some flushing and blushing. Did you have any problems with that?
I did not. I did not have any problems with that when I was using it, although I did stop using it when I was getting all of these flare-ups.
And then what did you do after the CE ferulic?
I would use sunscreen.
Okay. What
like
sunscreen?
a Neutrogena sunscreen moisturizer,
SPF
30.
Okay, good. And then did you use the same cleanser at night?
At night I would use, it was a Neutrogena, like an exfoliant cleanser at night.
So it had some kind of granules in it?
A little bit of some granules in it.
Okay. So just so you know, because I don't really ever criticize people on the products that they use. I really like to ask this question because I also like to see how invested people are in skincare, how much time they spend on their skin, And it gives me an idea also of, sometimes people say, oh gee, I'm really dry or I'm really oily, and it might be due to certain things that you're using. But in general, if you use anything that's abrasive at all with rosacea, it increases that inflammatory aspect. And so it can really trigger the inflammatory protein that's kind of the underlying cause of rosacea, which we'll get to that. Okay, so what did you do after the exfoliant?
I was actually for a while using like an Olay product. So it's been a while since I've used it.
It's like one of their products that I probably have peptides in it. That type of thing.
Yeah. For anti-aging.
So like a night cream.
Like a night cream, exactly.
And anything that you did after that?
Nope.
Okay. Anything else that you did occasionally, like any kind of mask or anything like that?
I never did any masks.
Okay.
I haven't done any masks.
All right. So let's go back to some of your concerns. And this is great. I don't even know where to begin. Okay. So let's talk really what we're talking about again. I've said this many times, is we're talking about general skin rejuvenation, because general skin rejuvenation is not just about fine lines, it's not just about discoloration, it's really about rosacea, it's about mild to moderate acne, it's about all of the kinds of common skin concerns that people have that they want to address so that the skin looks uniform, the pores look smaller, you don't look dull, you have a really great glow with your skin. It has this reflective nature about it, just looks younger and healthier, okay? So that's kind of what we want to address, and within that, hopefully we'll be able to do something that helps with the appearance of your rosacea. So, virtually everything that we see in our lifetime that we think of as typical signs of aging, fine lines, wrinkles, etc., happen before the age of 10. It's cumulative sun exposure. Now, even if you weren't a sunbather, unless you grew up with sunscreen on every minute, cumulative sun exposure contributes to a lot of this. And if you were a sunbather, and if you had a lot of outdoor exposure, then of course it gets into your DNA, and it's going to be even more prominent. We know that at least 50% is programmed in your skin by the age of 20. It just takes 10, 20, 30 years to show up. And a lot of times these changes tend to show up when we get into perimenopause and menopause. So perimenopause, the average onset is between 37 and 39. Menopause between 49 and 51 is the average onset of menopause. And what happens is that we see things like, we see drops in estrogen. We see drops in hyaluronic acid. Estrogen plays a major role in hyaluronic acid, and you have more estrogen receptor sites in facial skin than anywhere in your body. So it can play a role in bone resorption. It dovetails in with what we call intrinsic aging. Now, intrinsic aging is what we call the true aging process. So there's three segments of aging. So one is heredity. You inherit your bone structure. And you inherit certain tendencies. I always say, if you want to know how you're going to age, look at mom, dad, grandma, grandpa. Skincare doesn't change your bone structure. High cheekbones make a big difference, a prominent jawline, etc., in how you're going to age. Framework that holds everything up. The other one, which is intrinsic aging, there are certain things that are going to happen even if you don't have sun exposure. Now, it's exacerbated if you have sun exposure. But for example, by the age of 60, 80% of females will lose the show of upper teeth. The upper lip actually elongates. So even if mom or dad isn't smiling broadly, you'll see more of the upper tooth line, or more of the lower tooth line than the upper tooth line. Everything elongates. Noses don't grow, but if you have a prominent nose, the nose can droop. It can actually broaden through the base. Earlobes elongate, 30 centimeter in men, a little bit less in women. One of the big things is that we talk about volumization. As much as 50% of what we perceive as aging is loss of volume. So when a face, and that's hyaluronic acid. So hyaluronic acid is something that's part of connective tissue. It's the common denominator in aging, whether you are a bug or a human being or a horse. So since we're shrinking to death and we lose volume, and when the face is well volumized, the highest point of the face is known as the youthful triangle. The highest point, the widest point is the cheekbones, and it narrows into a nice, well-defined jawline. We talk about oval faces. Actually, the most desirable face is really kind of heart-shaped. And as we age and we lose volume, the cheek pad moves down. You start to see a nasolabial fold, but that area starts to flatten. And instead of being the broadest, highest point of the face, it's lower, it's flatter, and the broadest part of the face becomes the jawline area as time goes on. I know this is really depressing, but anyway, it's going to get better.
It is.
So female faces become more masculinized, and that's why we often say that when people live together for years and years, they start to look alike.
Because women start to look like men.
Exactly.
I have noticed that. That was one of the things I wanted to say that I have noticed, and I'm so glad you said that, is I do feel that my face is looking more masculine.
Well, it's
just broadening. It's changing.
The thing that's sad is that when men age and they become more masculinized because the cheek pads move down, we look at that as a good thing. We say, oh my gosh, they're so rugged. You look at people like Sean Connery, or you look at people like Harrison Ford that continue to make action movies, and they play these rugged, hardy people, and we don't look at it the same way. No. But the fact is the female face becomes more masculinized. And so there are certain things that, unfortunately, skincare really can't address. There's fat herniation. Fat herniates underneath the eyes. Fat herniates underneath the chin. There's jowling, and those are things where cosmetic surgery comes in. And again, I'm not ever one to suggest people should run out and get cosmetic surgery, but just realistically, what can we expect to accomplish with skincare? With cosmetic surgery, fat pads can be pulled back up, you can define the jawline, et cetera, et cetera, et cetera. But 90 to 95% of what we perceive as inevitable aging is sun exposure. There's so much that you can do. Cosmetic surgery doesn't replace good skin, and good skin doesn't necessarily mean that you don't need to have cosmetic surgery. But I can just tell you, I've seen many people that have had cosmetic surgery, and they really don't look younger. They might look better, but you need good skin. So good, healthy skin is really critical. Okay, so I'm just trying to think again where I'm going to start first. When we talk about skin rejuvenation, probably one of the most important things that we can possibly do is something that I call resurfacing. And resurfacing is where you're using a combination of acids and literally helping to make the pores look a lot smaller. Mm-hmm. It also addresses some of the superficial kinds of things like discoloration, make the skin look a lot brighter. And when you're constantly turning over those cells and you're resurfacing the skin without abrading it, it just starts to look more volumized. It looks younger, it looks healthier, it looks more even, and it just has that nice, smooth, really silky look to it, which is kind of, I think, what most people are looking for. In addition, there's a lot of medical data. Today, one of the primary tools used in medicine for rosacea is glycolic acid. Now, people say, well, it's an acid, but it's actually an anti-inflammatory. And glycolic acid has been shown medically to stimulate glycosaminoglycans, which are made up of hyaluronic acid, mucopolysaccharides, ceramides, phospholipids. They give the skin volume. I could go on and on about that. When we put it together with glycolic, salicylic, and azelaic acid is sold by prescription for rosacea. It's also one of the best resurfacing agents I've ever seen. It's fantastic for the appearance of fine lines and wrinkles. So some of these tools that we use for skin rejuvenation can have a dramatic effect on some of the other kinds of skin concerns and the appearance of these skin concerns. That's going to be a major part of the program that we're going to recommend for you. Now, the other thing that we're going to have in your program is we're going to have Rosaleaf, because Rosaleaf, and we've got some really good studies on this, this is dramatic for the appearance of redness. One of the major factors that we now know in rosacea is that you produce an inflammatory protein. We all do. It's known as cathelicidin. And cathelicidin is a protein that is great in terms of wound healing. It's necessary to help mediate various types of factors that go into helping things to heal. But if you produce this inflammatory protein for no reason, you're sitting in a hot room, it's stuffy, you have a glass of wine, you eat spicy food, maybe you're just having a stressful day and your skin is just kind of going crazy. So what we need to do is we need to help your skin not be as reactive to that protein, okay? And again, dealing with the appearance of the redness and those kinds of factors. And part of that is going to be understanding your triggers. Rosacea is a disease of reactivity, not sensitivity. You can have really sensitive skin, not have rosacea. You can have rosacea, not be particularly sensitive to skincare, not be particularly sensitive to topicals, but you have triggers. And understanding the triggers could be red wine, it can be spicy food. Some people, it is anything from chocolate, avocados, berries. Some people, it is managing, for example, I've had workout rosacea. And some people, when they work out, the rosacea flares up. One of the ways that it may help to control that is you suck on an ice cube while you work out. Kind of keeps that inflammatory response down. So it's understanding your triggers and managing your triggers. And sometimes if you go out and you have a really spicy dinner, you may not necessarily see the effect that evening or even the next day. It could be 2 or 3 days later. And then you're dealing with your skin being really inconsistent. There is no cure for rosacea. However, generally we can get people to consistently look as good as they look on their best day or better. But as part of it is managing the triggers, okay? So what we're going to do is today I'm going to put you on a skincare management system, and I'm also going to have you using Rosalieve. Now the other thing that I'm going to put you on the skincare management actually for normal combo. And even though your skin is not combination, I find that there's so much emolliency in the system that unless you're really, 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 really dry, we'd be overdoing it. I think you're going to find this is a lot more emolliency than what you've been used to. And so the Rosalieve. Now the other thing that I'm going to suggest for you is I'm going to suggest Marini Luminate Eye Gel. Now, Marini Luminate Eye Gel is personally probably my favorite eye cream, although we make some really good eye creams. It has retinol in it. It is fantastic for fine lines. It's fantastic for crepiness. But at the same time, it also has an effect on dark circles. That was what it was primarily developed for. But even though I don't have dark circles, I just love the way that it just kind of makes the eye area look very illuminated, because it addresses certain factors that as we age, we have a tendency for, even if we don't have dark circles, the blood vessels are more prominent, the skin is thinner, and so we see these irregularities more, and it can really make a big difference. And we've got some good before and after pictures if you go to the website. So the Luminate Eye Gel. Okay, the other thing that I want to recommend for you, and some of these things I might not have you use right away, but because you like using an exfoliator, and most people do, because the exfoliator, at least temporarily, it makes your skin look brighter and smoother and it makes your pores look smaller. But I generally never recommend exfoliators that are kind of the granulated particles in them, unless they dissolve. Because even though it may feel good, it can create microscopic tears in the skin, and it can create inflammation. And there's just a lot better way to exfoliate. And so one of the ways is with Cleanzyme and Skinzyme. And Cleanzyme and Skinzyme is what we refer to as a proteolytic enzyme. It is green unripened papaya. It's about 50 times stronger than ripe papaya. What it does is it digests dead and diseased tissue, but it can't hurt normal living tissue. It is aggressive, but it is so gentle. We even have physicians that use this shortly after laser resurfacing. So you have skin that hasn't even re-epithelialized, and yet we can use this to get rid of some of that dead skin. Doesn't hurt it at all. And I have to confess, this is one of my favorite products. I use it every single night because when you take it off, it makes your skin look like glass. So it's one of the reasons that I think that I've been able to get to the point where my pores are so much smaller. Now it's everything put together, but this is a great product. And there's some things that I'm going to probably, for in the future, once we kind of get your skin more stabilized, that I'm going to recommend for you. One of it's going to be Marini Luminate. And Marini Luminate is highly, highly anti-aging, but it also specifically is going to target an undiscoloration. Now, I think you're going to see a difference in the overall uniformity of your skin as you go through this process, but we can then specifically zero in. And I always say, even if you tell me a month or two from now, Jan, my skin's the best it's ever been, and I'm so much happier because my rosacea is much better, blah, 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 I can get it to look even better. So we'll keep working with this. I'm going to have someone check back with you. Either I'll check back with you or my assistant will check back with you in 4 days. 4 days is about the time, around a week to 4 days, when people decide whether or not they like a product. And you need help. You want to know. You want to make sure you're using it right, or if you're feeling something, is that normal? And then we'll continue to check with you periodically because programs need to be adjusted, modified due to seasons, things like that. But the idea is that we want to keep on supplementing it in a way that she can see more and more results with her skin. Okay?
Fantastic.
Are you excited?
I am so excited. I'm sitting very quietly, but inside I feel like I won the lottery.
Inside, she's just excited.
I'm so excited. I'm thrilled. Yes.
Well, anyway, we're going to have fun following her, and hopefully at some point she'll come back and we can hear all about how her skin has improved. So, without further ado, I want to thank you for viewing today, and please, please, please subscribe. Thanks again. Bye for now.